Greetings, Advocacy Committee members. We are thrilled to offer you Advocacy Committee training modules to help provide you with the tools and resources needed for your Advocacy Committee. In this module, we took the questions most frequently asked by committee members and provided responses. As the committees evolve, the answers may unpack themselves differently as we learn new strategies and develop best practices. If you ever have any questions, please reach out to your State Director of Advocacy or your local staff person. We will add those questions to future versions of our State Advocacy Committee Handbook and video modules such as this. Thank you. So what is the purpose of your committee? The purpose is identifying opportunities to recruit, train, and cultivate advocates and ambassadors, to help monitor barriers to access safe, affordable treatment across all platforms on the federal, state, and local levels, to serve as the voice of arthritis patients in pursuing federal, state, local legislative or rule changes, and to offer patients and their caregivers opportunities for connection, education, and empowerment through the Live Yes Arthritis Network. So let's do a little bit of level setting and what are the basic expectations. Confirm that everyone on the committee is an ambassador so that they can get advocacy in action and action alerts. If you are not sure, please ask your State Director of Advocacy and they can let you know if your member is part of our grassroots network. We'd like to also make sure that your committee members respond to action alerts and share with their contacts. Recruit and engage new advocates and ambassadors through the network. Become familiar with the advocacy section of the Arthritis Foundation website and position statements, and also to monitor state legislation of interest. What can your committee do beyond the basics? Participate in national and local trainings, such as webinars, committee meetings, and in-person trainings. Connect advocates, ambassadors, and other volunteers to local activities and fundraising, and help cultivate Platinum ambassadors. Actively participate in the Live Yes online community. Participate in social media alerts and help to educate advocates about new laws affecting their access to care. Participate in legislative meetings, hearings, Capitol Days. Help with new caucus member recruitment. Build relationships with state officials. Committees also have that flexibility to determine state-specific goals in addition to the expectations listed. We really want to make sure that our state work plans closely align with each other. So how can the state advocacy committees help identify new issues? One of the most important responsibilities for the State Advocacy Committee is to help identify new issues for the Arthritis Foundation to take a position on. Any new issues can be brought up during regular calls or to the State Director of Advocacy directly. We can then take that issue and discuss with the National Advocacy Committee. This is really just to determine if this is an issue that is occurring in other states. Advocacy staff will then work together to start writing a position on the statement, using the appropriate committee as a resource. And once approved, the Arthritis Foundation will then be able to take a position to solve the issue in the state. But of course, for issues requiring timely responses, state advocacy committees will be used as a rapid response team to determine a position on the issue. We have been hearing quite a few frequently asked questions from our advocacy committee members. So let's look at some of those questions. So what is the expected time commitment of the committee? It is a minimum of 2 conference calls a year, but many times quarterly meetings seem to be the preference of most committees. Additionally, there will be email correspondence, especially if issues bubble up on a quickly basis. So how does the advocacy committee interact with local market staff? Local market staff, like community engagement directors, executive directors, are always part of the committee calls. Local market boards will be represented on the committee by their local leadership board advocacy chair. As the committee works through their goals, this is done in partnership with the local staff and with your State Director of Advocacy. Is there something committee members can do to prepare for each meeting? So prior to each meeting, an agenda will be sent out with key topics that will be covered. It's helpful and more expedient to read any materials that may be included in the agenda. Are committee members expected to fundraise? Fundraising is an expression of your commitment to the organization, and it is hoped that each member will generously give or contribute services as their circumstances allow. Are we expected to be an Arthritis Foundation ambassador? We hope that you would choose to become one. Being an ambassador will ensure that you are up to date on all facets of the Arthritis Foundation advocacy program. Ambassadors serve as the official liaison between the Arthritis Foundation and their state and federally elected officials. The Ambassador Program serves as a strategic function of the Arthritis Foundation's mission by establishing and building a strong grassroots network, ensuring that Congress is aware of the needs of people living with arthritis and is primed to take action. How will your meetings be the most productive? We really would like for members to prepare. If they know that they're not going to be able to make the meeting, to let the staff and their committee chair know in advance, to speak up and share your opinion, and of course, ask questions. Another question, is this committee just going to provide state updates, or is it action-oriented? Though the committee will be a great opportunity to gain information and updates about state and federal legislation, the committee members will also be our go-to advocates for helping set priorities for state advocacy activities, op-eds, testifying hearings, speaking with legislators, recruiting advocates and ambassadors. How can I use my network to expand reach for advocacy? Definitely would like for you to use social media to share action alerts, links to sign up to be an advocate, and how bills will impact people with arthritis. And never hesitate to bring up that you are a committee member when appropriate and talk about what the Arthritis Foundation is working on. This could lead to amazing things. Can I talk to the media as an advocacy committee member? Yes, however, we do ask that you talk to the Arthritis Foundation first so that we can provide to you with resources such as talking points. Are we supposed to get involved with Jingle Bell Run, Walk to Cure Arthritis, or other local events? The answer is yes. If there is an event near you, this is a great opportunity for you to volunteer and or join a team. There is usually an advocacy/mission booth where you can help recruit new advocates. You are also encouraged to invite a local legislator to attend and to speak a few minutes about the importance of people becoming advocates. How long is my term on the committee? Terms are for 1 year and are renewable. Thank you for participating in this Advocacy Committee training module on frequently asked questions. If you have questions, others may have those same questions. Please submit those to your Advocacy Committee Chair or your State Director. We appreciate your time, and thank you again.